Good afternoon, everyone. My name is Shelley Ware and I'll be your host today. And I'd like to start by acknowledging the traditional owners of the land on which we meet today and listen to each other's stories and watch our wonderful event today. I would also like to acknowledge all elders past, present and emerging and pay my respects to all Aboriginal and Torres Strait Islander people who are watching and listening today. So I'd like to welcome you to the third Life and Health Reimagined online event, Streets for People. This week, we will explore how local living is changing in communities and how we can maintain the positive aspects as we emerge from lockdown. And unfortunately, we have had some suburbs here in Victoria which have gone back into stage 3 lockdown for the next 4 weeks. And they can still take something from today and certainly into the future. Now we will hear from Mel Finberg.
Hello everyone, and thank you so much for joining us today. I'm tuning in from Maribyrnong, just near the beautiful Maribyrnong River, and I'd like to pay my respects to the traditional owners of the land, the Wurundjeri, Woiwurrung and Bunurong peoples of the Kulin Nation. Wherever you're tuning in from, welcome. I'm so excited for today's discussion, Streets for People, Lessons from a Return to Local Living. We've all been moving around our neighbourhoods differently these past few months. We've been leaving the car at home so we can explore our local streets by foot or by pedal. Today we have an amazing panel of speakers to explore what this means for our future and how we can make these really positive changes stick. So get comfy and enjoy the conversation. Thanks again.
Thanks, Mel. Well, we're certainly comfortable and looking forward to today's panel. Let me explain now the format of today's event, Life and Health Reimagined. Well, we'll start today's event with a short overview presentation of today's topic from Professor Anna Timperio from Deakin University. After that, we'll dive straight into a discussion from our brilliant panel. And so please post any of your questions or vote for your favourites on Slido and we'll get to as many as possible. You can also post any technical issues that you may be having on Slido and the team will try and help you as soon as possible. So we'd like to welcome back the fabulous Jessamy from Think in Colour, who will be capturing today's discussion in live illustration, which will be available after the event. Now, the recordings of today's event will also be made available on the Life and Health Reimagined webpage. And finally, if you'd like to multitask, and you can join in the conversation on social media using the hashtag #HealthReimagined. So let's now play a short presentation from one of this week's authors, Anna Timperio, giving an overview of what we'll be discussing today.
Hello. I'm Anna Timperio from Deakin University's Institute of Physical Activity and Nutrition. I'll provide a summary today of the paper Billie, Giles-Corti and I contributed to VicHealth's Life and Health Reimagined series, which focuses on the opportunity that has arisen to keep as many people as we can walking and cycling into the future. During COVID-19 restrictions, with limits on non-essential activity and an obligation for many to work and study from home, most people's lives became constrained to their local area, with exercise one of the few reasons people could leave their homes. As a result, we saw more people out and about in their local neighbourhoods, using local streets and paths for walking, cycling and exercise, getting to know their local areas better. In a survey we conducted during May, more adults reported walking as a family and cycling for leisure during the restrictions than they did in February, especially those with a child aged 5 to 17. Keeping this going into the future is important. Walking and cycling are simple forms of exercise that can make a significant contribution to our health. Large proportions of Australians of all ages do not meet current physical activity recommendations. Can we turn this around through keeping walking and cycling going? Can we also help the environment by encouraging people to walk or cycle to school, to work and to other places instead of getting into cars, by making walking and cycling the norm? Encouraging active travel to school is one way to keep people walking and cycling and to keep cars off the road. Rates of active travel to school have declined substantially in Australia in recent decades, and over 1 million kilometres are travelled by car every day, getting children to and from primary schools in Melbourne alone. There are many reasons for this decline. These include distance, the convenience of driving, parents' confidence in their child's abilities as a pedestrian or cyclist, and safety-related concerns. Uniquely though, the pandemic may have helped to overcome some of these barriers. With more local walking and cycling during the restrictions, many children will have gained important skills and confidence as a pedestrian and cyclist. With more people working from home, parents may have more time to accompany their child to school on foot or bike, and there may be more eyes on the street or local surveillance from others, which may help to alleviate concerns about strangers. Parents may have also allowed children more independence during this time. However, critical barriers to walking and cycling among children, and indeed for many adults, relates to the pedestrian and cyclist environment and concerns about traffic safety, particularly for bikes. These concerns may be exacerbated if traffic increases as the restrictions are eased and if public transport continues to be avoided. So getting more people walking and cycling to school, to work and for errands where they can will be a critical part of avoiding future traffic congestion. So what can be done to create a more favourable environment for walking and cycling? Walkable and cyclable environments make it easy and safe to choose to walk and cycle. Spending on safe pedestrian and cyclist infrastructure for all should be a priority for post-COVID recovery and beyond for a healthier and more active society. Improving safety from cars is critical, particularly for children. Safe places to cross the road, footpath improvements, bike paths and traffic calming are important solutions. Bicycle boulevards leading to schools, activity centres, public transport and along key commuter routes where there is physical separation from traffic may be key to making cycling safer and more attractive to more people. Decades of development have seen roads and streets primarily designed around the movement of cars. There are approaches to designing streets where the needs of all road users are prioritised, ensuring ease and safety of movement by foot and bike as well as by other modes. Taking this further, there are examples from across the world of local streets where pedestrians and cyclists are prioritised over cars and the space is shared, such as voineufs or living streets. A better connected and integrated bike network is also key for supporting cycling and can make the entire journey to and from home safer. Identifying and connecting broken links in cycling paths is important, particularly if these can lead to schools, activity centres and public transport hubs. The delivery of the government's plan for walkable 20-minute neighbourhoods, where residents are able to access most of their needs for daily living, such as shops, services, amenities and parks, within a 20-minute walk, are critical, and this has important potential for shifting many short car trips to walking. There are so many benefits to walking and cycling for the whole population. This is an ideal time to invest in creating supportive environments for recreational and for transport-related walking and cycling to create a healthy and more sustainable new normal. Thank you.
Thank you, Anna. Well, you're certainly right. It is now the perfect time to make walking and cycling a part of our new normal. Some brilliant information there from Anna. Thank you very much. Well, we'll get straight into our panel now. And our first panel member, who is actually here with us today in the studio, feeling quite strange to have someone here, but it's great to also have somebody here. So Professor Billie Giles-Corti, welcome. And she is a distinguished professor at RMIT University and director of Urban Futures Enabling Capabilities Platform. She is the National Health and Medical Research Council Senior Principal Research Fellow and directs the Centre for Urban Research Healthy Livable Cities Research Group at RMIT's Centre for Urban Research. For over 2 decades, Billie and multiple disciplinary research team have been studying the impact of the built environment on health and well-being. So welcome, Billie. It's great to have you here.
Great to be here. Thanks, Shelley.
You don't
nice
need to
be
give
out for once.
It is nice to be out, absolutely. And Anna, if you could give us a wave, please. Anna Muessig is here. She's an associate at Gehl Studio, based in San Francisco. So she stayed up late for us, so thank you very much, Anna. Gehl is committed to making cities, neighbourhoods and places where people have control over their health and well-being and are enabled to take meaningful, climate-conscious decisions within their daily lives. Anna is an urban planner specialising in creative placemaking, cultural programming and economic development. At Gehl, she leads public life studies, designs public realm action plans and uses creative interventions to shape the culture of what streets can be. And give us a wave, please, Councillor Jackie Fristacky. Welcome, it's nice to have you here. And Councillor is with the City of Yarra, representing the Nichols Ward. Jackie is represented the City of Yarra since 2002. Councillor Fristacky is the highest priorities in includes strengthening the planning scheme to preserve Yarra's heritage streets and shopping strips, and further enhance Yarra's streets and precincts through landscaping, traffic management and place management. And our final panel member is Councillor Seema Abdullah. She is the Mayor of the Greater Shepparton City Council. Seema's qualifications include a Master of Business Administration and a Master of Science in Information Systems from London School of Economics, and she moved to Shepparton in 2009 with her husband and 2 children. Lovely to have you, Seema. Thank you for joining us today. It's wonderful to have such beautiful people here today with so much wisdom about what we're talking about. So we'll get straight into it. And our first question is for everybody. And we will start with you, Billie, but it is coronavirus restrictions have brought many people's lives closer to home, which has meant that our local streets have been functioning in a different way. So let's start with some reflections from our panel about the changes and opportunities that we've been seeing, both broadly and in your local community. So, Billie, what have you got?
I think the thing that's really brought home is just how important the local community is, living in neighbourhoods and the quality of your neighbourhood. So people who have done well, who have been fortunate to have had shops and services nearby, they've had the opportunity to go to their local park, and so many people have said to me, oh my God, this is the first time I've really explored the parks. Usually I'm going off and the kids are going off somewhere else, but this is an opportunity to really explore the local parks. We've seen walking and cycling taking off. I mean, we've had on shared paths, we've had conflicts of users, which is good and bad in one way. Bad because it tells us that we should have separated paths in many places, but good because we're seeing so many more people out using these services. And I think people have come to appreciate and love their local neighbourhoods. And I think importantly, we've seen, as Anna said, families out walking. We've seen a lot of people going out as family groups, going out and exploring their neighbourhood and getting to know their neighbourhoods like they've never done before.
I've certainly seen that in my local neighbourhood, that's for sure. Now, Anna, what are your thoughts?
It's been really interesting from here in the units to see how people are experiencing their streets and communities in a different way. I think from where I sit here in Oakland, California, in the Bay Area in particular, really understanding that people are experiencing this crisis in a different way, and it's disproportionate. So actually, more people are unemployed in this moment than I've ever experienced in my lifetime, and many of the challenges that we face as a society with regards to mobility equity, economic equity, are even more greatly felt. So certainly there's some major challenges that this crisis is really laying bare in our societies that we're dealing with. On a positive note, here at Gehl, we always try to use data about how people actually experience space to guide our strategy with cities and different communities. So at the very beginning of this crisis, we sent a survey asking everyone in that we knew, that we set it far and wide in the US to understand how people are using public space in this time. And we found some really interesting things that I'll continue to get into in this panel, but we're finding that people are using public spaces and streets in particular, not only for movement, but actually as a place to connect with their neighbors, to connect with their families, exactly as the previous panelist had said. Treating streets as places, not only as corridors of movement, is something that we focus on at Gehl, something that we're absolutely seeing now in the crisis. Worldwide, whether or not we'll see that moving forward with the challenges that public transportation is experiencing, I think is something that I'm really interested in following and interested in discussing with this panel.
Yeah, streets as places, that's certainly something I've never thought of, but it certainly is something that we're definitely doing, that's for sure. Now, Jackie, what do you have to add to this?
Well, I live on the Canning Street bicycle path, wide streets with great footpaths, just recently been tree planted on the side of the road as well as the median in the middle. And terrace houses with small front gardens, but most of them have got front gardens. And it's been wonderful to see how many people have been out in the streets walking. There's a high percentage walking anyway. In the data, 12.4% 2016 walk to work, nearly 9% cycle to work. So that's over 20% who did that, and 35% drove. So with working from home, we see people who are now walking who would have driven to work, those 35%. But those who would have walked to the train or bus, or well, not much bus in Yarra, only 1.8%, but train 11.8% and tram 14%. Those people walk to those, to catch their tram or train, and so they're used to walking. So we have got a reasonably high percentage of walking and cycling anyway, but it's certainly flowered in our cycle paths. The capital city trail's been chockers. People, it's 3 metres wide. We widened it. It's good, but people walking both directions with families, and then cyclists in both directions. It's really put pressure on those facilities. It's been good if you're working from home. You've got a good household, large enough to have studies and kids to have the separate study, if they're school age, and a front and back garden. But 50% of our households in Yarra are in apartments, and many are one-bedroomers, two-bedroomers perhaps, and that makes it tough. You've got to get into a lift. Well, social distancing is problematic. So you're encouraged to avoid that. Then staircases in a high-rise, if it's 10, 12 stories, they're not usually quite that high, but 5, 6, 7, 8, you've still got lifts. Anything above 3-story, 4 stories has got lifts. So you've got these difficulties. And there's many apartments without balconies. You can't even go outside, get fresh air to exercise on the balcony. So these minimum apartment standards are really being put under pressure, I think, for the growing number of the population that is living in higher density apartments as against high density terrace housing, which have got the front and backyards and you can exercise out there and be in the front garden. So I think there's certainly been a lot of people in the streets on the cycle paths, and it's been fantastic to see. But there's been a lot of problems for those who are in small apartments where they're apartment bound.
And we will touch a bit on that, Jackie, too, about mental health and how we can certainly support people in that space, because that is a big problem as well at the moment. Now, don't forget that you can send your questions into Slido, and we would love to hear from you and ask the panel what you would like to know. So, Seema, let's go to you now on adding your thoughts. It's always hard to go last. I know that feeling.
It's all right. I agree with so many of the other statements that have been made. But to start with, from a regional perspective, what I would say is that we all know Australia. We are saying that in this pandemic, Australia has been lucky, and hats off to our leaders who have taken such swift actions. And Australia, when we compare ourselves to other parts of the globe, we have really done well in this pandemic. And in regions, like I live in Shepparton and I was in Greater Shepparton, we believe that we have been luckier in a sense that regional people, they believe that, it's regional living is always for us, it has had its benefit, and we had always appreciated, our first of all, the biggest benefit of not having that traffic congestion, which a lot of my, here panelists would have experienced in the living in the metro areas. So this is something that we had already appreciated, and it was part of our living, that we do not have to worry about long commuting distances and all those things. But when this pandemic came, we, again, like everybody else, the community was feeling anxious and uncertainty and not knowing what the future is going to hold. So all those were like common sentiments. But amongst this whole crisis and challenges, what we have seen is that people who were already appreciating our open spaces and our proximity to our natural assets such as our rivers, our bushes, and our thriving wetlands, they are sort of taking more interest in those areas now. So we have always seen cycling and walking along our river trails, for instance, river walking trails. But during this pandemic, we have observed that more people are experiencing those walking trails. We are seeing more people out on the streets, as everybody else has said, more people with their families, especially young families. They have really embraced this change, which is such a positive. And as I've said, our river walking trails are just getting busier, so which is just fabulous to see.
Yeah, it sure is wonderful to see, but there are also some downfalls in this time as well, Billie. We've got people's mental health being a problem, a huge priority at the moment. So what recommendations would you make to local councils so people can remain healthy mentally and physically?
Well, I mean, in some ways the horse has bolted, because I think the people who will do well out of this at this time will be those who have these amenities so that they can do things while they're still in shutdown, but they can still enjoy nature and the great outdoors. I mean, that is a great thing for mental health. What's really important is also people's connections with people, knowing that there's people in the neighbourhood that they can call on, and that's around building social capital. So obviously that's a really key part. That's a foundation for a community, is knowing people who you can call on, because it's become very local. It's not people you can rely on further away. And even in buildings, in apartments, knowing that there's neighbours there that, you know, if you're in trouble, that you can call on. So, you know, and that's sort of like a more internal, that's for the owners' corporations and things to set up. But I think these are really critical things that are needed in a time like this. And in a way, the communities probably have done better, other communities where the councils were doing that already, that they actually anticipated any crisis, because they're preparing their communities by building social capital and, you know, having the facilities there in the first place. So I think they're probably the ones that have done better, and I'd be interested to hear what the councillors are saying. But I think it's really, you do these things in time when you don't have a crisis, because when you do have a crisis, you're ready to go. You've set yourself up. I think it's a very critical role for local government.
Yeah, and Jackie, what have you, as in your local council of the Yarra City, how have you prepared for the well-being of people in their mental health? We talked about the physical, but what about mentally in this time?
Well, we did pass in April, I think it was 4th of April, you can look on the council meeting, an economic and community support package, just under $7.5 million. And part of it was supporting vulnerable people obviously we've got staff, but also contacts. We've got a good number of welfare organisations, the community, and liaising with those through our staff. Most of them working from home, and they've been redirected had to change some of them, the casual staff. We've employed some extra casual staff. But people working with vulnerable communities and liaising and engaging with those support organisations to work with vulnerable communities. So that's been that is an important area. But it has been very difficult, as I mentioned. If people living in one-bedroom apartments, it's very tough, and I think it's putting stress on people unduly, because where's the breakout space? Where's the breakout space? You know, the cooling off room. Traditionally, people have been, guys in particular, have gone out to the men's shed at the back of the property and done some tool work or various other things, worked on their car. But you haven't, particular sorts of households haven't been able to do that. And that, I think, is something we've got to really think through in our planning for the future, because it is our apartments have been too small and not had breakout spaces beyond, whether on the balcony or extra rooms, is a real issue. So we have tried, but there is a difficulty. We've been a bit fortunate, I think, in Yarra, because we haven't, although we're surrounded by councils that have had more cases, we've somehow kept ours a bit less. I don't know whether it's more disciplined community or just luck, or fact that we have got, I think, some 75% of Yarra's heritage, and those buildings are quite well designed for engaging with neighbours. I mean, you go out you look over your front fence, you see a neighbour, 1.5 metres away, and walking the streets, people walking past stop and engage with people on their front steps. So there are some really positives about it from that perspective, but it is those vulnerable people, the elderly. There have been home visits. Of course, there has to be care taken. So there are those issues, but we have been. I think we're a bit have had some advantages in most services are within walking distance of people's homes. So the village shops, the local shops, they're within 10 minutes walk of many people's homes. Not always, maybe 15, sometimes 20, but really a good walking distance. So people can get out and about, and they don't have to get into a car and drive by and large. So there are certainly advantages for us in our communities. But I think we've encouraged people to undertake exercise, because we know exercise and music and other things are really good antidotes to those sort of mental pressures. So I think having those strategies for resilience and encouraging your communities to be resilient, using those skills and breakout spaces, going for a walk, rather than bottling it all up and letting it all out in terms of aggression to a partner or member of the family or others is really vital.
Thank you on that, absolutely. Now, Anna, how do we support, this is a question from Slido, so thank you, Hazel. How do we support people in low socioeconomic areas where these communities are not conducive of supportive or active travel or physical activity, noting that we don't want to further entrench the health inequities?
Yeah, absolutely. I mean, it's a really important question to understand how this crisis disproportionately impacts people who already are experiencing challenges. I think something key to understand is that many of those people, especially in the United States, are working service jobs. They're working at the bank, they're working at the grocery store. They have to work more than people like me. I'm able to work at my job, at my kitchen table. And so, ensuring that I'm close to a street that takes care of my needs and making sure that I have a park that I can walk to is wonderful for me to kind of get a sense of fresh air. But people who are working really on the front lines of this crisis, our basic needs as a society, are the people who really need the most help. And they actually don't need help first and foremost in spaces to relax and get mental health, although that is important. They need a way to get to work safely. They need transport options, whether that's active mobility or public transportation, them to their place of work safely, and they need protections from their workplace. So this is something that's absolutely on my mind. And there's been a lot of dialogue in the United States, especially as we undergo this really important conversation around the movement for Black lives and racial justice in our country, for us to think about how are we as a planning community and a public health community showing up in our neighborhoods in different ways. It's something that I've been thinking a lot about is actually we've heard, for example, in Oakland, Oakland did an incredible job of closing 10% of the streets through traffic, meaning that 10% of the streets are sort of wooners in the way that you're describing. They're partially closed for people to walk and cycle and scooter and bike and so on. And there was some pushback from communities who are struggling with more basic resources, for example, effective transportation and public open spaces. There's a long history of pilot projects in disadvantaged neighborhoods that don't actually show up in a capital investment. So when you talk about the need to go out and experience public life, which we're so desperately missing, I think our most vulnerable communities don't need pilot projects. They need capital investments in meaningful places to gather that create equity and justice in the public realm in our streets and our communities.
Absolutely. Now, Seema, do you have anything that you would like to add to that point on a regional focus? Oh, you have both.
Yeah, sure. Thanks. Yeah, sure. What I would first of all like to say is that, look, this concept of local living is really not foreign to us in regions, because our communities have always been connected, very connected, inclusive. People. If you go out on the streets, people know each other. They will say hello to you, and it seems that you would sort of everybody knows everybody else to a large extent. So, and people are there to sort of give support to others, and so the community, in terms of our community, they are already very they are connected, and there's a great pride in that sense of community. Volunteering, for instance, is really high, and a lot of people, they want to give back, and they want to communicate, and they want to give that support. So we've always had this this feeling and this sentiment that community support is crucial, and that's what we take pride in. However, in this COVID-19, again, what happened was that due to all these uncertainties and due to these sort of unusual circumstances and unusual challenges that were thrown our way, again, it was our community, and together with the local leadership, that came together, and there was this concept of collaborative leadership. I'll just give you one example that in the beginning, there were so many areas which needed attention. For instance, there was food insecurity, there were family violence issues, there were homelessness issues. But community decided and agreed that we have to together. So we came up with the initiative of Greater Shepparton Response. Now, Greater Shepparton Response is a platform whereby different community leaders have come together, and they interact and they exchange information on the basis of what services are needed at what part of the region, and how those, and whoever can deliver those services. So there's a matching of supply and demand of those services, and that is done through that platform, which is called Greater Shepparton Response. And there's also a website portal that was developed, and it was all really it's an example of how quickly and rapidly a council and local community had responded. And then, to give further support to our community, council came up with its economic response package, stage 1 and stage 2. We knew that a lot of businesses are doing it tough. So there was a quick response grant that was released so that businesses can quickly transit to online platforms, because nobody, especially in the hospitality sector, cafes and restaurants, people were not going there, and they still can't. So they changed their model quickly with the support from council. And so that's there. In terms of what's happening with the walking and cycling aspect, this is again, we announced our budget, council announced its budget, and extended shared footpaths, and these are basically included in our Capital Works program for 2020-2021. And we really want to build those infrastructure for walking and cycling, and to encourage our community, and so that they develop and continue with this positive habit. So that's some of the issues that we dealt with. One more aspect I would just like to raise is that we also felt that music and arts and culture, they all play a vital role in communities' health and well-being, in our livability. So council also provided support. We sort of came up with a program whereby our local artists are now able to do their live concerts, and which is live streamed. And it has been such a fabulous experience, and we have just seen that so many people have enjoyed and thoroughly enjoyed this opportunity to be able to play and to showcase their talent for our local artists, but also for the audience to stay at home and relax, because that's what they needed, to relax, calm down, and think positively. So council has been able to provide that opportunity.
Sounds absolutely wonderful. Now, Lucy and Rich on our Slido have asked a similar question, and I'll ask you, Billie. It's about how do we not rebound to our old ways of getting in the car, and how do we act on it now so that people, that we can make a difference with not going back into our cars? How do we make that happen?
Well, I think it's up to all of us, actually. I mean, I think that's the really important thing. What I've come to love to see is that people have started to really appreciate their local parks. My team members, have got children saying, well, because they can't drive their cars everywhere, they're suddenly taking their kids to the local parks. Oh my God, there's such great opportunities here for biking and walking, and I guess we're very blessed actually in Victoria. We do have a lot of facilities around, and so I think it's really important for us as a community, as every one of us, to use that as an opportunity to change our own behaviour. And I think that's the one thing that we wondered about in terms of children returning to schools. Many people who live close to schools, 750 metres from school, drive their children to school. And at the moment, we've got a lot of people still working from home. Not everyone's working from home, but a lot of people are working from home. Why don't we choose, and that would be good for us as adults, if we're walking our kids to school, then that's a way of getting our own physical activity, and also the child gets to walk to school, and we're building their confidence to do that. That's one way we can do it, and I think if at the moment, because of the pressures on public transport, as we return, people do start to return to work, if you can walk or cycle, do that. Like I live in Fitzroy, I can easily walk to work. I don't need to catch the tram. Sometimes I do. I don't need to do that if I'm going into the city because it's a couple of k's and I can easily walk. It's great for me in terms of my physical activity, but it's great because it frees it up for someone else who's going to be using public transport. So in a way, it's up to us about how we change. We're willing to change, and I really think it's an opportunity for the government to we have come to appreciate how important local living is. We have policies like the 20-minute neighbourhood. This is the time to do the 20-minute neighbourhood, to really make that happen. And when we've got stimulus money, let's don't build it on more roads. Let's put it into the schools that are needed and for those to make the 20-minute neighbourhood come together. The swimming pools or the community centres. Let's help the construction industry with opportunities for work through stimulus money going into things that will build the 20-minute neighbourhood. It's so critical. We've seen how important cycling infrastructure is. We need more cycling infrastructure. It's been fabulous to see councils that have taken the leadership to do pop-up bike paths around the city. Let's make that permanent bike paths across the city and really transform ourselves. I think for all of us it's an opportunity. I know it's been dreadful for many people and there's lots of sadness, but I think it's really also an opportunity, and it's really up to each of us as well as governments and local government to look at how we can go back from this better, having a greener, more sustainable future and a more equitable future rather than going back to business as usual.
Yeah. Absolutely, agree with you. Now, Jackie, just want to hear from you from the City of Yarra. What are you putting in place so that we don't just go back to the old, and that we really adapt this new way of living?
Well, I think that not just Yarra, but a lot of local governments are grappling with this issue, as is the Department of Transport, because the alarming statistic given by Jerome Weimar, who's head of transport operation, the network operations running the public transport system, was that I think it was on the 5th of June, he said the data showed that 80% of the pre-COVID vehicle traffic on our roads had already returned. And that's with people working from home, schools closed, businesses closed, so on. So there is a movement to try and offset that as much as possible, given people feel safer driving than being on public transport because of the social distancing and the risks. So the Metropolitan Transport Forum has written to all councils, our council members in the metropolitan area. There's 26 members, both inner, middle and outer members, asking them about their active transport proposals and asking them to also meet with their local members, because unlike San Francisco and Oakland and those areas where the local authorities can do things themselves without approval, certain things, if they need to be on arterial roads and even on local roads, if it involves changes in traffic signals and so on, and a streetscape, need DOT approval. So there's been a lot of work through Municipal Association of Victoria, representing councils working with DOT to try and fast track approvals. And the letter that Metropolitan Transport Forum wrote to all MPs, Metropolitan MPs, is to ask them to support active transport initiatives by local government, from the state and local governments to work together. So that's in general terms, and we had a meeting actually last night of the Metropolitan Transport Forum where this was discussed, and the letter sent to MPs on the 23rd of June and asking councils to progress that independently with their local MPs as well. So many of them been doing. We, like City of Melbourne and other councils, have embraced trying to do pop-ups. We had a resolution that can be seen on our council website, www.yarracity.vic.gov.au, resolution on the 23rd of June, responding to earlier motions from councillors, setting out a active transport support package, which I think was item 11.1 of that agenda, which has got a range of pop-up measures. And that included the Capital City Trail I mentioned earlier, looking at, even though that's 3 metres wide, looking at an adjacent street, Park Street, to take the cyclists as well, to have bi-directional lanes. We're looking at liaising with other councils to improve cycling on Heidelberg Road. That's Arterial Road, and there's been liaison with DOT. We've looked at realigning road space for cyclists at a range of routes and intersections in Wellington Street, Copland Street, Gipp Street, Nicholson Street. So there's quite a bit of work. We've just, in terms of pop-up cycle paths, if Duncan could put up the picture, we just opened a new segregated bike path on Elizabeth Street, Richmond. That went up early this week, and it's open now for cyclists. They opened yesterday, so that's yesterday's photo. The cyclists haven't found it yet, and it's not altogether finished because that's a segment that is completed. So Church Street to Lennox Street in Richmond. So that's on. We'll have that on both sides of the road. So that's a concrete initiative that's been done. We've had pop-up parklets so people can walk to their local cafes and restaurants, get some takeaways, but instead of queuing on a narrow 16-foot frontage footpath, we've got some parklets outside premises, Gerald's Bar on Rathdown Street in Rathdown Village, near La Porchetta. We've Proud Mary and quite a few others where we've got those parklets to encourage people to walk or to their locals. So look, there's a range of measures. Councils were a bit hampered by the fact that under the Local Government Act, local governments can't make decisions unless they meet physically. Now that was only changed from the 1st of May. So for a couple of months, we weren't able to meet to determine what to do. But that was a bit of a delay. But there was work being done in the background. But to determine council initiatives, which requires council budget and money and allocations, we needed to have that capacity to meet virtually, and that's now possible. And so we've been able to make those determinations. So there've been a lot of initiatives, not just Yarra, but City of Melbourne. You've read about more, but many other, Port Phillip, Darebin, Moreland that I know about, and Banyule have been looking at initiatives as well.
Oh, great to hear. I think there are a lot of people that are definitely working really hard in this space so that we can have a better future. So, Anna, I'll come to you. Lily has said here that she was able to walk to work already. She was only a suburb from home, but now that she's relocated to the CBD. How can we work at decentralising workplaces, and who needs to be leading on this issue?
That's very interesting. Well, it's a conversation that we've been having in my office right now. We all live in different neighborhoods, and we're really talking about decentralizing our own office. So it strikes close to home. Some of the panelists were talking about the idea of the 20-minute city or the 15-minute city. This is something that advocates have been talking about for a really long time. Mayor Anne Hidalgo sort of coined the term, Anne Hidalgo of Paris, being able to walk or cycle a short trip to all of your daily needs, to your pharmacist, to your grocery store, and so on. I think that's what we're talking about when we're talking about sort of decentralizing workplaces or our CBDs. I think something that's really struck me is that many of us already live in a 20-minute city. We just accidentally use our car. And it's actually not the most efficient way to get to where we need to go. In the United States, about 50% of all car trips are under 3 miles. At Gehl, we've worked a lot with scooter companies to think about how they can optimize their deployment strategies and have more equitable programs deployed in cities. 3 miles is a perfect trip for a scooter. It's a perfect long walk. It's a great bike ride. So many of us already live in these sort of 20-minute cities. You were asking earlier about how we sort of change the DNA and change our habits of how we experience our cities into the future, how we can maybe hold on to some of these good habits that we're creating right now. And it really is about not only pilots, although that's absolutely a step in the right direction. It's really about putting this into the DNA of our streets. We've had the great opportunity to work with Vic Roads recently on a streetscape design guide. It's sort of like the Australian version of NACTO, the National Association of Transportation Officials, that we have here in the US. And we worked on a movement and place urban road and street design guide. And I love the tagline, which is streets for us to live, work, move, play, and stay. In fact, a street creates all of these different opportunities for us. And I'll evoke an old chestnut from Gehl, who founded them and also worked for a long time with Rob Adams in Melbourne to transform the center of your city. It's very cheap to be sweet to people. In fact, many of these strategies that we're talking about for making the 20-minute city more realistic, making a street that actually gives us all the things that we want, including connection to our family and to nature and all of these things, it's actually a lot cheaper than designing more arterials for roads. So, as a lot of cities are grappling with budget cuts, especially here in the United States, we have an impending economic recession. It's really an opportunity to align our budgets with our values and really thinking about how we can put people first in creating the streets of the future. It's what we've been experimenting with here in the United States. We've been helping communities as they open up, which actually means moving everything that was inside back outside. So restaurants are now outside, retail is now outside. We're helping cities do that through designing their streets in different ways to accommodate all of that. And just the final thing I'll say in this conversation about public health and transforming our public life and our cities in the future in light of COVID is that we've talked about this idea about the hammer and the dance. The hammer is when we all realize we have to go inside to prevent the spread of this virus. The dance is really how we spin up and figure out how we can go back to or create a better standard of living in the future. Something that I think has been underexplored in the urbanist community is really monitoring strategies for ensuring that we're opening up safely. That's something that we've been doing at Gehl, is helping communities track the safe use of their public spaces by adapting our public space, public life evaluation methods. It's something that we've actually have an app for, and we're really trying to help communities transform the DNA of their cities, their streets, into this resilient infrastructure that can serve us in COVID, in the brighter future that we hope to have.
Beautiful. You've answered a little bit of the question I was going to ask next. So I love what you had to say then. There was a lot of good things in there. But Seema, I want to talk to you and ask you just about what Anna touched on. What do you think the chances are of us utilising footpaths for businesses to stay alive during this crisis? That was a question, I think, from Billie.
Look, again, this is it's a positive development that has come out of this whole crisis. And at council level, we want to, and we are striving to reinforce this positive message by working with our partners. And again, it's about it's an issue which is related to not only the infrastructure side of things, but also it's a behavioral issue. So we have to tackle it from different directions. So one of them is, of course, for council to stay engaged with the community and communicate these positive messages and reinforce these messages. Get involved in the campaigns, and we have already been involved in so many of such campaigns, such as Walk to School, Ride to School, in partnership with Gehl, and also with cycling networks and pedestrian council. So all these all these collaborations are important so that we do not forget. We continue to be on this path, and we carry on this message, and we bring those behavioral changes among people to continue to follow these positive habits. The other part is, of course, about our about the infrastructure for cycling and for walking, whether we have enough extended paths where people can safely walk or cycle to work or to school or to other shopping areas. That's something that council is very much cognizant about, and it is on our radar. I'll just give you an example of some of our Shepparton Murupna plan for 2050. And this growth plan has been developed in association with the Victorian Planning Authority. And one of the 6 outcomes to achieve the targets of this growth plan include creating a city of livable neighborhoods. Now, when we talk about livable neighborhoods, we are talking about having the means to walk and cycle and to adopt these positive habits. So that's from the infrastructure point of view. And it's not only in big cities like Shepparton and Murupna, even in our small towns, for example, Tulemba, we are developing a growth plan for our township, and it is guided by the 20-minute neighborhood framework. So that will be really interesting because, of course, 20-minute neighborhood is all about being able to continue to, walk and cycle to all those places, to the businesses, to local shops. So that is something that is on our radar, and we'll continue to work on it. And through our land use planning, through our public health and well-being program. Actually, I did not mention about that, but council has the statutory responsibility to plan, to improve, and promote public health and well-being in its municipality. And we have different layers of this framework, and we deliver this plan through different strategies and plans. But all of them are talking about well-being and taking different talking about different domains of health and well-being. And one of them is, of course, your built environment, and also your social environment and the natural environment. So all these are very much part of council's strategy and council's plan.
Thank you, Seema. So would you like to see more businesses out in the street being able to run their businesses during this time of crisis?
I think it's a sensible thing to do, and I think that we're seeing, councils already doing it. The parklet idea, I think it's brilliant. I think that's, businesses are struggling at the moment, and anything we can do to support them is really important. Unfortunately, it's winter, unlike the Northern Hemisphere. We've got winter, and that makes it a little challenging. You sort of need the little blankies, and
that's
maybe
okay.
Bring your own blankie to be able to do outside, but it's just such a critical thing, I think, for businesses. I just want to pick up on some of the other points, though, because as Seema was saying about, local governments in using data to see, to create more livable, walkable neighbourhoods, we've got now the Australian Urban Observatory with all that data on it, which allows you to map where all that amenity is and where the opportunities are for where there needs to be more investment and where there is opportunities for those businesses. So I think that, we've got resources available now, and that's on our website, which people can use to be able to map their communities to see where the strengths and weaknesses are, and they can use it in their municipal planning to be able to deliver the 20-minute neighbourhood.
So you said that's on our website. What website?
It's on the Australian Urban Observatory. So if you search for Australian Urban Observatory, we've got it for 21 cities across all of Australia in our centre at RMIT. And so, it's a great resource for local government wanting to really look at, well, how can we deliver the 20-minute neighbourhood and, use it for their municipal health planning. It's a great resource.
Well, it certainly sounds like there is a lot of wonderful things going on. Thank you so much to our panel members and taking the time out of your day. And Anna, thank you for staying up late for us. It was wonderful. So thank you to Billie, Anna, Jackie and Seema, and also thank you to Jessimi, who has done some wonderful work that we've all got to see today when she's been drawing and writing about the fantastic things that you've been sharing with the community today. So thank you for that. And we appreciate your wisdom and supporting in keeping Victorians healthy in both mind and body during these testing times, and also what we can hope for the future and the lessons that we've certainly learnt during this time. So next week's Reimagined event is Wednesday the 8th of July at 2 p.m, and the topic will be health equity. We've touched a little bit on that today, and I'm looking forward to finding out that next week. I will be your host next week, and I hope to see you then. Thank you to people who did the Slido questions. It was certainly fantastic to be able to ask some of your questions as well. And take care, everybody, and we'll see you next week.